Hello, viewers. I am Professor Maruf Siddiqui, Clinical Director, Dhaka Fertility Center, and also an Executive Board member of Aspire. Welcoming you all on today's podcast. Today's topic is what should a clinician know about a man's general health when he has a low sperm count? So usually when we find a couple with the husband having a low sperm count, the directives are usually do for a ICSI or maybe an IUI. So in this episode, we're going to discuss about what general measures that we can take when a person has a low sperm count. So our guest is none but Dr. Vasan. He is a famous UroAndrologist, working as Director and HOD of Andrology at the Ankur Healthcare, Bangalore, India. So welcome, Dr. Vasan, in our show.
Thank you very much. Thank you, Aspire, and thank you, Maruf, for this invitation. It's a good opportunity to interact with you and Aspire.
Thank you. So it's a very short podcast, so we'll go straight into the discussion. So what do you think when you wish to take a general history of a patient? There are many factors that comes into consideration, but what do you think? What are the most important thing that you should emphasize on history taking when a person has a low sperm count?
Yeah, whenever there is a person with a low sperm count, the first thing we do is to look at the duration of the sexual activity, especially how long they have tried during the fertile period. Because bear in mind, sometimes men with slightly lower sperm counts can conceive because of the oocyte's reparative capacity, especially if the woman is younger. So we want to understand whether they have sufficiently tried, unless the sperm count is extremely low. That is the first thing we would like to do. And then, so that means you go through their sexual history, whether there's any erectile dysfunction. And then you look at whether there is any causative factors which might impact fertility in terms of comorbidity. So that is the first thing we look at. And the comorbidities could be sugar, diabetes, or thyroid problems, or erectile dysfunction, like I said, smoking, alcohol, and various factors. So we will rule out or eliminate these factors which might contribute to fertility problems in men.
Thank you. So let's talk a very common thing, that diabetes. Usually we know that uncontrolled diabetes may lead to loss of libido or may lead to erectile dysfunction. So correcting the blood sugar definitely going to help the couple to conceive. But what do you think? Do diabetes have a definite relationship with a low sperm count?
Yes, diabetes has definite relationship with low sperm count on two mechanisms. One, it causes oxidative stress, which can lead to damaging the sperm DNA and the cell membranes. And because of diabetes, people also develop some amount of autonomic neuropathy, which can lead to erectile dysfunction and ejaculatory dysfunction, which can happen in diabetes. So both ways it can affect, and a male can present, if you don't ask for a specific history, then he can present with oligoasthenia or teratospermia and male infertility.
So in that case, do you recommend that you try to correct the blood sugar profile of the patient by giving medications or insulins and then repeat the same analysis after 2-3 months? Do you recommend
See,
that?
essentially, diabetes, we know that causes oxidative stress, hormonal imbalance, and microvascular damage. These are the three mechanisms by which, but not all diabetics are affected. So what we look forward is, because diabetes in our part of the subcontinent affects almost 50% of the population,
Yes.
out of which, the fertile population may be 15-20% of the population. So it's a huge population. So if we have to tell everybody to wait for 3 months to correct. So we look at only those with HbA1c of more than 8, where there is a role for better control of diabetes. But if the HbA1c is less than 8, I think there may be other causative mechanisms. We should look for other causative mechanisms.
Okay. So I think the next point we can come to the history of smoking, which is sometimes directly related to, I think more important it is related to asthenospermia rather than oligospermia.
Yeah.
So what are your recommendations about that, about
Yeah,
smoking?
smoking definitely releases toxins and free radicals that cause oxidative damage to sperm membrane and DNA, which can impair basically the motility and reduce also the concentration. In both ways, it can affect, and it also reduces antioxidant levels in the semen, causing worsening the damage. So we all know that nicotine also has an effect on the hormonal levels, reducing testosterone and impacting spermatogenesis. So definitely cessation of smoking is a good thing, especially if you're trying for a baby. Of course, smoking is always harmful for your body. I don't think we as doctors should recommend smoking. But especially if you're a smoker, giving up smoking is very good for you because it will help improve the sperm parameters. But the duration of, because sometimes I find patients who come to me who says, I've given up smoking for about 15 days. Will it improve my sperm count? Generally, it takes 3 months for the effect of smoking to kick in. So that is something you have to bear in mind. The effect is not immediate, but definitely there is a positive effect of giving up smoking.
Okay. So some of the causes are already well accepted. For example, people undergoing chemotherapy, radiation, definitely they will have damage in the sperms, maybe leading to agiospermia in some cases. But some newer things, for example, a laptop on lap, we have been discussing it that could lower down your sperm count. So what do you think? What are the evidences of that?
Yeah, we did a study in India where we looked at the mobile phone and we kept the mobile phone with on next to the semen sample, and we did a control, and we found that yes, nowadays there are mobiles which claim the radio frequency waves are very less, but we found generally there is some impact on the sperm parameters, and the radiation, if the mobile is affecting, the radiation from the laptop is much higher, and I would presume so, and also the heat generated by the laptop, because many people work by keeping the laptop on their laps. So there is an amount of oxidative stress which this creates, and definitely it has an impact. And especially if you're looking for a baby, these are harmless things
Exactly.
which you should implement, because it might benefit you. It's not guaranteed to benefit, but at the same time, it is not going to further damage the sperm. So these are measures which you can take in terms of avoiding direct contact of the laptop, and reducing the heat level which the body receives from the laptop, by just keeping a small interface, maybe a gel pad, which will help you, because you can't give up your work, but you could at least reduce the effect of the laptop on the human body.
Exactly, exactly. So, what about the investigations? I know a very good seminal in a standard lab can detect all these things, whether it is a astino or a terato or a oligo. But what about the other blood tests? Do you wish to recommend a testosterone, a estradiol, or a prolactin in a patient with a low sperm count?
Yeah, and see, essentially, if you have ruled out all the extraneous factors, or what we call as comorbidity and lifestyle factors, we look for the intactness of the HPG axis. Basically, the hypothalamo-pituitary axis. If you suspect any abnormality in terms of hypogonadism, you can make this out by looking at the patient. Then there's a role to investigate your FSH, LH, testosterone. But otherwise, I would always recommend, because testosterone is the prime mover which initiates spermatogenesis. So, of course, we measure peripheral testosterone, but it's an indirect marker. So, doing a testosterone, and nowadays, because a lot of metabolic syndrome, we do an estradiol. These two are primary hormones, but if at all you are suspecting there is a small testis and there are signs of hypogonadism, then additionally adding FSH and LH would be beneficial in these kind of instances. And if there is any evidence to suggest headache and vision abnormalities, then you should add a prolactin, because prolactin tumors or prolactinomas could lead to libido problems as well as oligosteroteratosperm.
Okay, so ultimately it's seminal and maybe some free testosterone, estradiol, and prolactin.
Sure,
So,
sure.
what do you think about some special tests such as the sperm DNA fragmentation? Many centers are encouraging some of the patients to do it.
Yeah.
So, what do you think? What are the definite indications for doing a sperm DNA fragmentation?
Yeah, these are not routine tests. These are additional tests which are helpful because for a mass screening of a population, DNA fragmentation test is not necessary. But if you're looking at recurrent abortions, if you're looking at elderly couples trying to conceive, if you're looking at failed IVF treatment, failed IUI treatment,
Exactly.
or if there is a higher risk of abortion in a given individual, these are instances where you want to assess the sperm integrity much better because you don't want a repeat failure, and that's where these tests are recommended. So basically in cases of recurrent abortions, advanced age, recurrent IVF failures or ART failures, there I would recommend DNA fragmentation, which might give you an idea of the integrity of the sperm in terms of functional integrity, because the semen analysis, what we measure is the structural integrity, which is
Exactly.
basically your motility and morphology.
So it could be useful in certain cases.
Certain case.
Another thing about the scrotal Doppler ultrasound, you can see that many gynecologists are using that in Bangladesh. I think that will be the same scenario in India. So
Yes.
what do you think? What is the actual evidence? Because sometimes it helps to detect the varicocele and other things. So what do you think? Is it helpful?
Yeah, scrotal Doppler, if you are able to examine the patient, you would decide whether the scrotal Doppler is necessary. But unfortunately, I do understand some of the gynecologists may be hesitant or may not be well versed with the concept of examining the testis. And they would see men as a part of the workup along with the woman. So, in that kind of a situation, scrotal Doppler is helpful. But scrotal Doppler per se gives indication of the size of the testis. You would get an idea of the size of the testis because any testis less than 5 cc would constitute a small testis, and it would give you an indication of varicocele. Gross varicocele may impact sperm parameters. It helps you in decision making in order to streamline your management strategy depending on the female factor.
Okay. And another thing about varicocele, that sometimes we found that many doctors are even suggesting that you've got a varicocele, you go for a surgery and you will have a better sperm count. But in evidence, sometimes we don't find that unless there is a very gross varicocele. So what do you think about that? What could be the specific indication of doing a surgery on varicocele when a person has a low sperm count?
See, I think this is a highly controversial area. Urologists will push for
Exactly.
varicocele surgery.
Exactly.
Gynecologists and reproductive medicine doctors would probably look at ART as the first line of treatment, and there is a reason for that. The reason for that is basically because varicocele is present in almost 40% of the general population. Not all of them have infertility, only some of them have infertility. Now, even if they have infertility, now and we know that the effect of varicocele is oligoasthenospermia, but repairing a varicocele, how much does it correct the oligoasthenospermia is debatable. Generally, even if you do the surgery, the recovery takes 6 to 8 months. It doesn't happen overnight. And though there is the sperm count recovery is one thing, the clinical pregnancy rate is another thing. So consequent to that, clinical pregnancy rate, even post-surgery, is approximately anywhere between 25 to 40%. So, and that too over a period of an year, which matches with your ICSI percentages or
Exactly.
ART percentages. So consequently, there'll always be a debate. Why do we want to make a patient wait for 1 year and give him a 25 to 40% success rate when we can give him a chance of having a baby earlier? So this is controversial, and I think each doctor has to take whatever in his practice, or take the patient age, the female woman's age, and the aspirations of the couple, and then not decide, on a case to case basis, decide on the basis of aspiration of the couple. I would go by, if the couple are keen on having a baby earlier, then I would not do a varicocele surgery. If the woman's age is higher, I would not do a varicocele surgery. So these are the ways you have to look at structuring your surgery.
Exactly. Very nicely narrated. Actually, the dealing with a person with a low sperm count is very, very difficult. The
Yes.
semen parameters are notorious parameters. Sometimes you get a very good parameter, and after 3 months is very low. So it's sometimes very fluctuating also. But however, as the ART specialist should definitely refer them for an ART or maybe for an IUI. But I think the take-home message should be that if we can take some general corrective measures for controlling the diabetes, maybe quit smoking, decreasing your weight, having a good BMI, having a healthy lifestyle, that would sometimes help us. Maybe minor borderline cement parameter, it goes to a normal parameter. We can allow the patient for a timed intercourse or for a ovulation induction. Maybe trying to get some of the group of patients to a better parameter, at least converting some ICSI to an IUI or something like that. And at the end of the day, if it doesn't goes to normal, finally it is destination. So thank you so much, and I would like to thank you from ASPA for taking part in this podcast. And any take-home message you wish to give?
Yeah, I think male infertility globally is increasing, and that is basically because of most of it is lifestyle. We are not still sure why the male sperm count is declining, and this is specifically so more so after the COVID, in which the pandemic, we are seeing more and more infertility. So I think the take-home message is we should be cognizant that environmental factors and lifestyle plays a significant role in protecting the male sperm, and a bad environment or a bad lifestyle definitely has a detrimental effect. So the first steps I would love to take is, like you pointed out, keeping the BMI as low as possible. Ideal BMI is anywhere between 25 to 28, and also ensuring that you, if you're looking for a baby, at least to control your smoking and alcohol habits, and also if you have any comorbidity like diabetes, thyroid, or any other comorbidity, dyslipidemia, then have a better control of them, which gives you a chance of improving your own sperm parameters without medical intervention. And I think that is very, very crucial, and also reduces the risk of abortion. That is very crucial.
So we should definitely consider doing this before just proceeding the patient with an ICSI or IUI. So
Absolutely.
maybe that is a take-home message. So thank you so much, viewers, and thank you, Dr. Vasan, for the nice podcast. Hopefully, it will be beneficial to all of you. So till the next podcast, it is bye-bye from all of us. Thank you.
Thank you.